Assalamu alaikum. This is me, Dr. Lateral. Today I will discuss another important case which I encounter in my ward rotation. So a 50-year-old male present to us with the chief complaint of the tendency to fall toward the left side of the body. He was also having facial numbness on the left side of the face, and he was having difficulty in swallowing. He was diabetic and hypertensive for the last 10 years. This was the history of this patient. Then I proceed to the examination of this patient. Examination, he was oriented in time, place and person. GCS was normal, and vitally he was stable. Eye examination show left-sided ptosis, left-sided ptosis, and also the left side there was asymmetry of the pupil, and left pupil were more constricted than the right pupil. There was a nystagmus in the lateral eye, and the first component of the nystagmus was toward the left side. And there was also another finding in this patient in left eye. When I asked this patient to close the eye and then suddenly open the eye, the eye would deviate toward the left side. This finding of lateral nystagmus and the deviation of the eye toward the left side on opening is called the ipsy-pulsion. And also the palatal paralysis was present, gait reflex was absent, and the uvula was deviated toward the right side. Now the rest of the examination was unremarkable, like pain, temperature, pain and touch temperature, vibration sensation, also the reflexes, and everything was normal in both the upper limb and the lower limb. So based on the history and examination, I concluded that this patient might have some infarct, some tumor or other abnormality in the brainstem. Why in the brainstem? Because this patient has certain nerve involvement which arises from that area. Like for example, this patient has left-sided facial numbness. Left-sided facial numbness may indicate that this patient has involvement of a trigeminal nerve. As trigeminal nerve has a long root, for example, it arises from the brainstem and goes up to the pons and medulla. So this patient might have some lesion in that area. That's why this patient has a left-sided facial numbness. Also, when I asked this patient to walk in front of me, this patient was having wide base gait, and the patient would sway toward the left side of the body. And also, when I asked this patient to go on straight line, the patient ataxia would increase. So this was a typical gait of ataxic cerebellar gait, and there might be an involvement of either inferior cerebellar peduncle or maybe the cerebellum in this patient, as the medulla and pons are present in the vicinity, the cerebellum are present in the vicinity of those structure. This patient was also having palatal paralysis and dysphagia, so there was a 9 and 10 nerve involvement in this patient. There was no any sensory involvement, but so we conclude that there might be a lateral medullary syndrome, so lesion in the lateral medulla. But this patient do not have any loss of pain and temperature sensation in the contralateral, I mean right side of the body. But remember, it's not necessary that all the features of the lateral medullary syndrome is present in the particular patient, because the lesion might be small. This patient was also having Horner syndrome, and Horner syndrome can be explained like this: that the hypothalamus have a sympathetic outflow. This sympathetic fibers run along the lateral part of the medulla, and when the lateral part of the medulla is affected, it may result in the Horner syndrome and ptosis. So we then order MRI in order to confirm our diagnosis, and MRI was astonishing, and MRI includes small infarct in the lateral medullary area. So this case was confirmed by MRI, and I will show you the picture and video of that films of the MRI, and you may see that there was a small infarct in the lateral medulla. So this was a case of lateral medullary syndrome involving that trigeminal nucleus, descending sympathetic fibers, inferior cerebellar peduncle, and 8 and 9 nerves. So always take a detailed history and thorough examination in order to reach a definitive diagnosis in any case. And make a habit of these things, because proper examination will lead you to the definitive diagnosis.
So this was it. Inshallah, I will upload more videos regarding clinical cases, counseling and general guidelines. Until then, Assalamu alaikum.